Sino ba naman ang hindi hahanga sa sipag at determinasyon ni Pangulong Ferdinand Marcos Jr. na mabigyan ng magandang buhay ang lahat ng mga Pilipino? Kaya nga ngayon ay pinangunahan ni Pangulong Ferdinand R. Marcos Jr. ang inaugurasyon ng Healthway Cancer Care Hospital sa Arca South State sa Taguig City noong November 24, 2023. Ang HCCH ay isang nangungunang institusyon sa pangangalagang pangkalusugan na nag-aalok ng malawak na komprehensibong hanay ng mga serbisyo ng kanser mula sa screening, diagnosis at paggamot hanggang sa pangangalaga pagkatapos ng kanser. Kabilang dito ang radiation oncology, operasyon, chemotherapy at palliative care. Ang pangunahing layunin nito ay mabigyan ang mga Pilipino ng mga dekalidad na serbisyong medikal sa pamamagitan ng makabagong kagamitan at dedikadong medikal na practitioners bukod sa iba pa. Ang pagpapasinaya ng pasilidad na medikal ay sumasailalim din sa isang malakas na pakikipagtulungan sa pagitan ng gobyerno at pribadong sektor sa pagpapalakas ng sistema na pangangalaga ang pangkalusugan ng bansa na itinatampok ang potensyal ng bansa bilang isa sa lumalaking destinasyon ng pangangalagang pangkalusugan sa Asya. Kaya naman mga kababayan, ating pakinggan ang talumpati ng ating mahal na Pangulong Bongbong Marcos patungkol sa pagpapasinaya nitong bagong ospital dito sa bayan ng Taguig City.
I am extremely pleased to join you today as we open this first hospital in the Philippines dedicated to cancer care, this Healthway Cancer Care Hospital. I have to congratulate the Ayala Healthcare Holdings, Inc. And its chairperson, Fernando Sobel de Ayala, for this noble achievement. Let me also recognize the city government of Taguig, the Department of Health, the FDA, for their efforts in accelerating the process to establish this facility. The opening of the HCCH will go a long way in improving access to quality cancer care for many Filipinos. Moreover, this endeavor highlights our strong partnership with the private sector in strengthening our healthcare system, which is aligned with the Philippine Health Facility Development Plan and the Integrated Cancer Program. All of this is geared towards our goal of universal healthcare. With the help of HCCH, we can revolutionize the cancer care service industry in the Philippines through modern, state-of-the-art equipment, coupled with leading medical professionals and oncologists. It will certainly positively reflect on the country's growing potential as a leading healthcare destination in Asia. Cancer still remains as one of the most dreaded illnesses in the country. Secretary Ted Herbosa just informs me that the cancer is now number 3 in terms of mortality for our general populace. However, with facilities such as this, we will allow the main weapon that we have in combating cancer, early detection. Early detection, this allows us for patients the best chance in fighting this disease. We therefore encourage all Filipinos to get regular checkups now that we have the facilities by going to community health centers. We have also made available primary care services where patients may consult for early detection of cancer. Our PhilHealth Consulta primary care team is also available to provide free diagnostic examinations and laboratory tests. For cancer treatment, we have designated 25 specialty centers in cancer care in select DOH hospitals nationwide. So I encourage the public to maximize these programs, services, and facilities for cancer care, prevention, and treatment as the government strives to bring healthcare closer to the people. We recognize that there are great financial burdens to cancer treatments. So to ease the hardship of cancer patients and provide equitable access to healthcare, we have also established the Cancer Assistance Fund, which will pay for the cost of cancer diagnostics and laboratories not covered by PhilHealth. So as we establish a more accessible, efficient, and responsive healthcare system, I urge all public and private stakeholders to support the Philippine Health Facility Development Plan and invest in building more health facilities similar to the HCCH. Rest assured that the government remains committed to nurturing an environment that upholds the total well-being of our people, of course, with the continued support of our private partners and investors in healthcare. I believe that this is also, not only is this an important day in terms of healthcare and in terms of our capabilities and capacities to help cancer patients and to also those who need early detection, those who need testing, to give that facility to them. And it is important because we never had anything like this before. And it is a testament to the forward thinking of many of our healthcare professionals, and both in the public sector and in the private sector, certainly. And it is very important, it shows that we put a priority on the healthcare of our people. I cannot forget very early on in my political career when I was reminded. I was governor then, and and my staff could not understand. It says you're using up 1/3 of your provincial budget for healthcare. We've never seen that before. And I quoted to them. I said, no matter how wealthy you are, no matter how successful you are, you cannot enjoy that wealth or that success if you do not have your health. And that is why it is a priority. It may not be politically saleable. Ang lagi kong sinasabi ko, pagka-eleksyon, sinasabi mo, tignan mo yung ginawa kong eskwelahan, tignan mo yung ginawa kong kalsada. What do you say about healthcare? Oh, our people are healthy. That's why people tend to deprioritize it because of political concerns. But nonetheless, I cannot remove that from my mind. I was told, I was advised, healthcare is important simply because nothing else matters if you are ill. Nothing else matters if you are sick. Nothing else matters if you are dying. And that is why I am so pleased. I am so happy to be here today, to see this as we progress in our healthcare system for the Philippines. We have learned many difficult, tragic lessons from COVID. And I am glad to see that we are applying those lessons learned now to the healthcare of our people. This is also important because it is a very clear example of how the whole of society, whole of nation principle can bring success. We in government provide the atmosphere, the environment to allow, to encourage even, to promote these kind of projects. And we have come together and we have come to this point, to this day, where we are able to say we now have a state-of-the-art cancer care center, which we have never had before. And I hope that this will serve as an example to many others who will say that this can be done, and to encourage them to do more. So let us work hand in hand as we take the challenges in public health and deliver quality medical services to our people all over the country. With all of us striving together in this pursuit, I am confident that we will succeed to bring forth a stronger and healthier Philippines in the future. Thank you, and I wish the men and women of the Healthcare Cancer Care Hospital all the best and all the success. Mabuhay kayong lahat. Mabuhay ang bagong Pilipinas. Magandang umaga po sa inyo lahat.